Okay, my name is McLaren, and today I'm gonna be talking about this diagram you're looking at here. I know most of us will be guessing, but most of us know what it is just by looking at it. Atrial septal defect. Also, this atrial septal defect is one of the congenital anomalies which happens occurs in the heart due to problems related to embryological malformations. It is not the only uh, anomaly that occurs in the heart. There are other ones ranging from ventricular septal defect, patentotus arteriosus, foramen ovale, tetralogy of Valor, some atresia, and even stenosis. All these are congenital anomalies that affecting the heart and the blood vessels of the heart. So today we're going to be specializing on talking about the atrial septal defect. So this atrial septal defect we're going to be talking about today, we're going to be looking at so many aspects of it. So, atrial septal defect is a congenital anomaly of the heart where there is a break in the atrial septal wall due to embryological malformations during development of the heart. This is exactly what atrial septal defect. We have a break in the atrial septum which separates the right from the left atria. So, what are the types of atrial septal defect? Okay, so there are three types of atrial septal defects, and we're going to be looking at them now. One is the atrial septal defect secundum. Two is the atrial septal defect premium, and we have the third one, which is atrial septal defect sinus venosus. All these are due to the locations of this particular defect. ASD secundum is located close to the foramen ovale. Sinus venosus, that's the third one, is located close to the superior vena cava, and ASD premium is down the septum. Now, shunting in ASD, how does blood flow or blood move when someone have ASD? Blood moves from the left to the right, left side of the heart to the right. So we'll have oxygenated blood moving to mix with the deoxygenated one. And so we'll have blood moving from the left atrium to the right atrium due to the break or breach in the atrial septal wall. And that is why we don't have cyanosis during ASD. It is because the blood that is moving is mostly oxygenated blood. That's the shunting in ASD. Now, which other aspect are we going to be looking at? I'm going to leave you to guess. Alright. Now let's get it. So we're able to talk about that, and now the next part we're going to be going into for the day is actually what are the causes of atrial septal defect. So we'll have two major causes. One is environmental causes and two is genetic causes. The first one being the environmental causes includes infections like rubella, maternal diabetes, teratogens like drugs. So we also notice that genetic causes could be from a particular gene, mutation in a gene called GATA4 gene. All this would cause mutations. All this would cause ASD, atrial septal defect. Okay, so when all these things happen, we might have a baby that has a breach in the atrial septal wall. So look at it. Okay, what are the clinical features of ASD? We have embolization, we have embolus, moving. So we have pulmonary hypertension, we have irreversible pulmonary vascular disease. So people that have ASD has a risk of embolization and all this. So what are the diagnoses? What can we use to make diagnosis? We can actually do echocardiogram and we'll make the diagnosis. We can actually use catheterization, pass a catheter down, maybe through the jugular vein, and we get it. We can also listening to murmurs of the heart through phonocardiogram can also give us what we need. Okay, so what next? What are we going to look at? We've seen the diagnosis. After diagnosis, what can we do when we notice that our patient is having this particular problem, this particular ASD? Okay, so what we can do is mainly surgical. Okay, so the treatment or management is mainly surgical. And since we know that the problem here is a breach in the atrial septal wall, what can we do surgically? We just have to close up this particular breach in the atrial septal wall. If we are able to close this breach in the atrial septal wall, then we are able to help that patient, because this will bring the hemodynamic balance back to book. You now have oxygenated blood moving into the right atrium through the defect, so we are fine, and that is what we want. So I remain McLaren, and I hope you're able to understand to some extent the thing about ASD and what I've been trying to pass down. So you can try and subscribe